All right, well, the death of Robin Williams is raising awareness about depression and suicide.
So joining us to talk about some of the warning signs is psychiatrist Dr. Daniela White. Welcome, Dr. White. Can you hear us okay?
Hey, yes, I do. Do you hear me?
Yes, we certainly can. Culturally, we use the word depression really casually. You hear people say, I'm depressed, I'm down, but there's a dramatic difference between feeling down about a life event and clinical depression, for which counseling and maybe even medication would be appropriate. Can you explain the difference between those two?
Yes, I hope I can, because it's really very important for people to know the difference and to go and look for help, for professional help. I think a lot of people equate depression with sadness, and depression is much more than that. And we get sad, and it's appropriate to get sad when we have losses, when we go through tragedies, when we have things to mourn for. But depression is more of a cognitive distortion of reality, how I like to call it, meaning that people who are depressed, they see everything through very dark glasses. So it's not only sadness, but it's decreased sleep, decreased energy, decreased drive, hopelessness, very frequent thought of death. And these people, when they suffer like this, they do not feel there is a way out. Their brain kind of tells them that probably sometimes the only way out is suicide. So they cannot see the reality the way outside people or their family sees them. And I think that's what makes Robin Williams' death so incomprehensible for a lot of people.
Yeah.
I mean, I hear that all the time, that he had it all, how come? And depression is really a very serious illness and
Sure.
has to be treated very aggressively.
Dr. White, you've listed many of the symptoms. What are some ways to combat depression, and how effective are they?
Well, first of all, is raising awareness. I think we're still fighting a stigma for the mental illness, and a lot of people do not talk about the way they feel out of fear of being isolated or considered to be crazy or losing their jobs or losing their families. So first of all, I think that society has to be more accepting, and I think Robin did a good job in terms of expressing what he was going through.
Sure.
The treatments out there are there. It's just sometimes we have what we call treatment refractory depression that requires multiple attempts at treatments, and if it's not medications, we have other therapies, including transcranial magnetic stimulation that sometimes can be used. So when somebody suffers, it's really paramount to have a support system to push them through the treatment and keep looking for a resolution. I mean, some people have several episodes and they treat them successfully, and they have to be persistent.
Dr. White, I'm glad you mentioned the stigma. What can we collectively do as a group, as a society, to try to combat that, to try to make people more comfortable to come out with this problem and maybe seek out the help that they need before suicide becomes the outcome?
I think it's just talking about it and making it accepted like any other chronic disorder. People are not ashamed to say that I have diabetes, but somehow people feel ashamed to say I have depression or I have anxiety or I have bipolar disorder. And I think those celebrities who have fans coming out and talking about their struggles is really, really important. We just have to be aware and in schools and work environments and everywhere where people struggle with it. Sure. I mean, mental illness, in fact, depression is right now the second major cause of disability globally, and by 2030, it's probably going to be the first major cause of disability, around the globe.
Right. Well, Robin Williams'
ahead
death
of chronic.
Yeah, his death is certainly raising awareness, and thank you, Dr. White, for your help understanding more about depression and suicide prevention.
Good
Thank you for joining us.
Talking about
Thank
it,
you.
for sure.